Hello friends, DrPoonamsvlog here, and today's question is from January 26, and the question I'll be reading from the screen. So her question is, "Hi Dr. Wonder Woman, thank you." Okay, so she has written. I'm just reading this question from my laptop screen. So the question is, "It's amazing the way you reach out to resolve so many queries with, of course, a ever warm smile." Which actually makes us feel that we have someone to run to when we panic about kids. Thank you, Janvis, for this comment as the start of the question. Now, the question is, what is convulsion in children, and which age bracket it affects, and what is the remedy? So Janvis, a very beautiful question, and I must say a question which has a huge content as such. That means if you tell me to speak on this, there is lots I can speak, but I thought let me just restrict to what the parent should know, okay, or what a common man should know regarding convulsions. Now convulsions is, what is convulsion? Convulsion in regular language or a common language would be fits. It is called seizures in our language, in medical language, or convulsions, basically loss of consciousness. What are seizures? Is there is usually a change in the level of consciousness. So you may be either having loss of consciousness. Sometimes there may be consciousness which is intact, but there may be abnormal movements of the body which are there. Okay. Also remember that depending upon the provocative agents, that is, why did this convulsion or why did this seizure occur? There are different type of convulsions, and it is just out of the purview of this video to cover the whole convulsion. Maybe some other time I will cover it, but today I am going to talk something regarding febrile convulsions, a typical febrile convulsion. This name itself, the whole entity itself, is called typical febrile seizure, which I think every parent should know, because the incidence of these febrile convulsions, the typical febrile convulsions, is about 3 to 4% in a general population. So what I mean by general population 3 to 4% is every third or fourth child in 100 children may experience a febrile convulsion. Now with the word itself, febrile means when there is fever. So basically when the convulsion or the seizures or the fits occur when the child has fever, means febrile convulsion, and we often see this type of children in our clinics or in our hospital setups. Basically the children's CNS, that is the central nervous system or the brain, is not completely developed. That's why they are very much prone to this. Now what exactly a seizure means? If you ask me that what exactly a seizure means in brain activity, okay, it's like, suppose I'm trying to put a plug in a socket and suddenly some sparks come up from that socket. Okay, those sparks is that electrical activity which is, try to relate it to the electrical activity that goes on in your brain, and suddenly there is sparks which come, and these sparks are something which causes the seizures in the babies. Okay, so now these seizures, that is the febrile convulsion seizures, the typical febrile convulsion seizures, are very common in children who are more than 6 months of age. Okay, they usually occur, first seizure will usually occur when the child is around 6 months to around 1.5 years of age, when the baby gets high fever, usually at the height of fever at around, when the fever crosses 39 degrees Celsius, that is around 102, there are higher chances of having seizures if your family has a history of typical febrile seizure. Now what is meant by this is that many times the parents themselves or the sibling, that is the brother or the sister of the index child, may have a fever induced febrile convulsion seizure in the past. Okay, so sometimes we have like the history from the mother saying that, yes, when I was small I used to get febrile convulsions, or sometimes from the father also we have a similar history, or sometimes we have history of the brother or the sister, elder sibling, that is the elder brother or the sister of such a child, having a similar history in the past. Okay, So now today I will tell you what you are supposed to do if at all you have a febrile convulsion of this sort. First and foremost, whenever a child has fever, see to it that you control the fever by giving fever medicine, by keeping the baby open, not overclothing, by keeping the room ventilated, by keeping a temperature chart so that you know that the temperature is not exceeding around 100 and 101, 102. For that, please see my old video, which I will put a link here somewhere here in the I button, where what are the danger signs that you should see when the baby has fever and how to manage the fever. The entire thing is covered in that video, so do see it. Okay, so the other thing is, whenever there is fever, always make a point to see what are the symptoms are there. That is also covered in that video. Today I will tell you when, if at all, unluckily your baby seems to have a seizure or is having a seizure, what you are going to do. First thing is, don't get scared. Children will come out of this seizure, if it is a typical febrile seizure, without much problem. So first thing that you're going to see is, if the baby is having seizure, put the baby on one side. Don't try to put something in the mouth, open the mouth, or give some smell of whatever onions and all other things that are done as a common in public. Okay, please don't do that. See to it that you remain cool, calm. Put the baby on one side so that if at all they have any frothing, or if at all they vomit during this time, the things can come out of mouth and not get inside. If you keep the baby on the back, those things can get inside the air pipe and can cause aspiration, which is a big problem. Okay, so put the baby on one side, wait for the seizures to get over, see what happens during the seizure. Put the baby on one side and don't restrict their movement. See what is happening. Are all the four limbs, that is hands and legs, being contracted? Okay, how much time is the seizures occurring? Is it more than 5 minutes? If it is more than 5 minutes, you start taking the baby to the hospital, start moving the baby to the hospital rather than trying all the remedies, because in a febrile seizure will usually last for around 15 minutes. So by that time, usually by the time you reach hospital, the seizure is gone and it is over and the baby is back to normal. Okay, but if not, if the baby happens to go to something known as atypical febrile seizure, so you are at least in the hospital by the time it happens. Okay, usually the typical febrile seizure will not reoccur within 24 hours, but still we prefer to admit the babies whenever they have a first seizure of typical febrile seizure, just to rule out the possibility of an atypical febrile seizure, possibility of having multiple seizures later on, or to ascertain what was the cause. Why did the baby have a seizure? Why did the fever occur because of which the typical febrile seizure occurred? Like many times these fevers are just because of, these fevers are caused by just simple viral infection, urinary tract infection, upper respiratory tract infection, ear infection, something of this sort. And once the reason is located, we can treat the underlying cause, and as well as the fever is treated. Once the fever is treated, the seizure is just gets treated. Okay, but there are chances, sometimes very minimal chances, that there might be underlying cause like a brain infection or something else which needs to be ruled out. That's why admission is warranted. Okay, then what are things that you're going to observe when the baby has seizure is, which are the limbs that the baby is moving. Is it that the one side is totally limp and only one side is it's shaking, like the contractions are occurring only on one side? Is it that the baby is totally having loss of consciousness? Is there any loss of control of urine and stools? So the baby will pass urine, the baby will pass stools during that time. Does the baby stop this? Does the seizure stop immediately after 5 minutes, 10 minutes, 15 minutes, 20 minutes? How much time do it take? So keep a watch on your watch which is there close by. Okay, also after the baby's seizures is over, is the baby back to normal completely? If not completely, is the baby having any deficit, like one hand is not moving, leg is not moving, or the mouth is becoming a little bit crooked, or the eye is not opening? You'll have to keep a watch on this and explain all these things clearly to your doctor so that they can come to a proper diagnosis. Okay, also remember the treatment to this febrile seizure will be mostly either admission, if you get admitted, admission, hydration, that is the baby will be given IV fluids, fever control will be done, tepid sponging to wipe the baby top to bottom, cause of the fever and the treatment for that cause will be done. At the same time, if the seizure is lasting for long, maybe certain anti-seizure drugs or anti-epileptic drugs may be started. Something like simple drugs like diazepam may be given through IV or through per rectum, depending upon the case scenario. You don't need to give it to all the children. At the same time, every time the child gets fever in future, there are always chances that they may get a seizure again. Okay, so whenever they get fever in future, there are chances that they may get a seizure again. So you have to be careful. Again, keep temperature control, tepid sponging, give fever medicine, keep a watch on what other symptoms are appearing, and go and show your doctor on the next day itself, so as to make sure that there is no cause which is going to cause fever for a long time. And at the same time, you may be prescribed two things: either a tablet which is named Frisium, depending upon the baby's weight the tablets are given, so as to prevent the baby from getting a seizure, but it is not 100% proof. Even after taking the tablet, some babies do get seizures. And there is one more option called midazolam spray. Okay, now this midazolam spray is given only and only if the baby develops a seizure in the next time. So your doctor will inform you how to use this midazolam spray, how many sprays to be used or how many puffs to be used, so as to abort a seizure which occurs at home, or if at all you are moving around with the baby somewhere on your travel and the seizure occurs there, how to use the midazolam spray. That will be also told. Remember, whenever you're using either midazolam spray or a tablet, you always make it sure that you have your thermometer, your fever medicine, and these two tablets, the tablet and the spray, in a packet in your purse. Wherever you're moving around with the baby, that packet has to go. Keep a track of the expiry date of such tablets and the spray, because they usually expire without use, and actually when you require them, when you open it, you see that the packet is expired or the bottle is expired. So to avoid these circumstances, see what is the date on that bottle and keep a reminder of that date, so that you buy a new packet or a new spray and keep it ready if at all the problem occurs. Such type of seizures can recur in the baby's life till 6 years of life, so you have to be very careful. At the same time, remember, they are not going to affect your baby's brain growth or your baby's IQ level as such, as long as they are typical febrile seizure. There are very minimal chances that these children can also have epilepsy, which is a total different topic itself. I hope, Janvis, I answered your query, and whoever else has any queries regarding the child care or any problems in the child, you can write it in the Google form which I am keeping in the description section below. Okay, and do follow me on my channel as well as ask me questions so that I can make videos for you. Bye bye.